Hello, my name is Ash Acharya. I'm consultant trauma and orthopedic surgeon. I specialize in surgery of hip and knee conditions and sports knee injuries. Today I would like to talk to you about anterior cruciate ligament injuries, also commonly known as ACL injuries. What is ACL? ACL is a ligament that runs in the knee from the tibia to the thigh bone. It supports the knee and avoids knee moving in awkward direction. How does one injure ACL? Usually, ACL injury is a result of twisting or pivoting injury. Although it is common in footballers, usually it may not be related to contact injury. Even on a rugby pitch or on the football ground, quite often the player may not sustain any direct blow to the knee. Quite often, the foot might be just fixed on the astroturf, the body might pivot, and the patient will feel a pop or a snap in the knee. It is also common in racket sports such as badminton, when if a player suddenly jumps and lands awkwardly and the body twists, you can get cruciate injury. Quite commonly, the patient may feel sudden pop or snap in the knee, will have sudden swelling. The patient then won't be able to get up and get going and might be carried off the field. It may take at least a couple of days for the swelling to settle down, for the pain to settle down, and it may take few weeks for the knee to recover. Quite commonly, patients with good going cruciate injury will notice that they can walk in a straight line, but if they were to twist or pivot or come down the stairs and suddenly twist or turn, the knee will give way. In a younger person who has more than 2 episodes of knee giving way, it is better to consider investigations and further treatment. How is cruciate injury diagnosed? I would take a detailed history, and the history that I just mentioned to you is quite self-explanatory. I will examine the knee joint and assess all the other ligaments and then the cruciate ligament. Then a patient may benefit by having further investigation such as MRI scan. This is also to look for any other associated injuries such as torn cartilage. What are the treatment options for cruciate ligament injuries? In a young patient, especially adolescent, if the knee is giving way or if the patient has a torn cartilage, then I would strongly recommend cruciate ligament reconstruction and treatment for meniscal injury. In patients over 40, sometimes cruciate ligament injuries can be treated without operation, and some patients can benefit by prior physiotherapy such as rehabilitation. However, if knee giving way affects your quality of life, if a person cannot trust the knee effectively, then it might be prudent to consider ACL reconstruction. It is a very simple and straightforward procedure. Usually, I tend to take one of the smallest hamstrings and then use it as a 4-fold graft in the knee. The whole procedure is done through keyhole surgery and the recovery is quite quick. The risk and the complications are fairly minor. Some patients may benefit by physiotherapy before the operation. Usually, patients would need at least 6 weeks to 3 months of physiotherapy after the operation. It is as important as having the right surgery. After the surgery, patient may need a brace depending on the meniscal surgery. But most of the patients are very happy with the stability of the knee. The result of ACL surgery depends also on associated injuries and what else is required during the operation. So sometimes it is better to have the operation earlier before a patient develops other associated injuries such as meniscal injuries. What is the expected recovery after cruciate ligament operation and what is the expected time to return to sports? Most often, patient may not need to use crutches after 3 weeks. If a patient has meniscal repair, then they may need to use a brace for about 6 weeks. If a patient has meniscal repair, then you can't do a deep squat or deep knee bend for up to 4 months. Otherwise, the rehabilitation is usually quite straightforward. You might be able to use bike and cross trainer within 2 weeks to 6 weeks. Usually return to sport is after 9 to 12 months. Once the strength in the knee is at least 90% that of the other knee, when there is no fluid in the knee and there is no pain. Usually it takes between 9 to 12 months.